There isn't one single way to evaluate MSK X-rays. However, I'm going to be sharing a systematic approach that I use when interpreting scaphoid X-rays. What is this method? There is a sequence. First, we look at the cortical margins, which is the process of tracing the outer layer of bone. Next, we look at the bony alignment. Are any of the connecting bones misaligned? The third is looking at the joints, which is in between each bone. So for example, we have the metacarpophalangeal joints. Next, we look at the trabecular pattern, which is the pattern within each bone on X-ray. And lastly, we look at the soft tissues. Let's take a look at what this looks like on X-ray. So as you can see, we have an example of a scaphoid X-ray. Now I've labelled all of the points in the method 1 through to 5 to show you what this looks like. First, we have the cortical margins, so we're tracing the outer layer of bone. Next, we have bony alignment, and this is the alignment between all the carpal bones. Third, we have joints, which is the joint spaces in between each bone fragment. 4, we have trabecular patterns, which are the patterns within the bone itself. And lastly, we have soft tissues. Let's also take a look at what this looks like at the side, as you will have to interpret lateral scaphoid X-rays too. So, starting 1 to 5 again, we have 1, the cortical margins. As you can see, with the blue line, I've traced the bottom of the scaphoid. With the orange, I've traced the bottom of the lunate. And with the red, I have traced the distal radius. Now, this alignment will be important when it comes to looking at laterals, as they should all be aligned. If there's anything out of place, this may indicate there's been a dislocation. Third is looking at the joints. 4th, the trabecular patterns. And 5, the soft tissues. Now let's take a look at what each of these points look like. Let's start with cortical margins. As we can see, this is an example of a scaphoid fracture. Comment down below if you've seen a scaphoid fracture in clinical practice before. Notice how when we outline the cortical margins, there's a break and it's not smooth. That's because there's a fracture right in the body of the scaphoid. Next, let's look at bony alignment. We have a perilunate dislocation, and what this means is when the lunate carpal bone remains in position, whereas the capitate and the bone surrounding the capitate all move backwards, or in other words, they move dorsally. Let's take a closer look at this on a lateral scaphoid. As we can see, this is a better representation of how the capitate and the bone surrounding it have moved backwards, whereas the lunate has stayed the same and has nothing sitting inside it anymore. Next, we're looking at the joints. Here we have a scapholunate dissociation, and this is a subluxation of the scaphoid. Notice how there is a much larger gap between the scaphoid and lunate, as there would be on a normal X-ray. Next, let's look at the trabecular patterns. Can you see this area on the scaphoid, which is brighter than the rest? That's because of something called avascular necrosis. And this is when bone tissue dies because of the loss of blood supply. This is due to the fracture through the scaphoid here. Soft tissues is our final one. And in this example, we're looking at a lateral scaphoid. And on the posterior aspect, just behind the radius and ulna, we can see a calcific body, which is a small bone fragment. Now, this is likely from an old injury, but it's good to always check the soft tissues for artifacts or foreign bodies such as this. Let's take a look at a normal scaphoid X-ray and use our method to analyze it. How do we know this is normal? Well, first, let's look at the cortical margins. Everything looks smooth when we outline the outer bone. Next, bony alignment. All the carpal bones are in their correct position and nothing looks out of place. That also includes the radius and ulna and the metacarpals. Next, we're taking a look at the joints. There is no abnormal widening anywhere. Everything looks in place. Next, the trabecular patterns. Patterns look even, and there is no increased or lower density in any areas that appears abnormal. And lastly, the soft tissues. We can't see any foreign bodies or artifacts in the soft tissues, no swelling or any other signs of abnormality. So this is normal. Are you ready for a challenge? Take a look at this PA scaphoid X-ray. What's wrong here? There is a fracture through the body of the scaphoid on this left hand, and using our method of tracing the cortical margins, we can see the break in this. Did you get this correct? What are some common mistakes people make when interpreting hand X-rays? Not slowing down. Remember, use a system which works for you and assess every area. You don't want to miss a pathology. And when you come across a pathology, don't stop there. you want to assess every area of the X-ray, including areas that are commonly missed. In summary, we've gone over a systematic method I use for analysing scaphoid X-rays. We've gone over common pathologies and have applied my method too. Let me know if you'd like me to make a separate video looking at oblique scaphoids. In our next video, we're going to be looking at how to position for a PA wrist X-ray. If you like this video, like and subscribe for more weekly X-ray tips.